All right, we're going to continue reviewing the rating tool, this time looking at the core team and the specialist team subscales. So with the core team, we pull it open and some information populates in. What is the FT of the team leader? But then we're asked a couple of straightforward questions about whether they've met qualifications, and a second level qualification is asking about whether they're licensed in their respective clinical field. If you need reminders about more information about the rating guidelines, remember that a PDF lives up here. And if you want to get some interview data, you can click here. So if we judge these like this, it automatically goes to green. You click it to turn blue, capture notes as you need to, and then move on. Because you made the rating, clicking it blue, it automatically crossed it out up here. Team leader is practicing. Clinician, you're making judgments about what was met here, and you get to the information by way of these tabs here. You have the item response coding, that's just a PDF from the standard eTMACT. You can look at interview responses, which pull up the relevant items here, and you can look at chart entry summaries as well. For here, you would probably go to all and just skim it to see the extent you saw examples of the team leader showing up. So we can make our judgments here, and then eTMACT will select. Psychiatric care provider and team, it's going to bring over everybody that's listed. So in this team, we only had one individual, and Dr. Long was 0.4 FTE. Does provider meet minimal qualifications? We can go up back to the item response coding to see what that is, but basically board eligible in psychiatry, not necessarily certified. And as soon as we did that, and this is output, it's bringing in for us to see the calculations, because you are calculating what is the equivalent of the FT. If they were serving 100 people, it is the equivalent of 0.85. And therefore they meet it. So make sure you click this blue, because it otherwise won't register your rating. And then psychiatric care provider in treatment. It is pulling over information in terms of the frequency of contact. It does not make that decision for us because it wants us to review it. And we can go back and look at the information directly. But if you're reviewing this within 6 weeks, oh, and this is one, let me go and pull up this other example that's more complete, because I'm showing you a review where the charts have not been fully looked at for the sake of giving us this tour. This one did. And actually, let's see, 90% 6 weeks. So this one is not one you're going to get a green. You have to review it and then review the criteria and make your decision. And like everything, you're clicking through, it's producing the output in green, you're confirming your selection. Psychiatric care provider within the team. This is you're just choosing whether yes or no is met for these criteria. There's a few tips built in here. And then based on your selections, eTMACT is making the suggestion. You can see down here, eTMACT is programmed to record your responses. Watch. See how that turned no? Because it's going to migrate this information over to the consensus sheet, which will be helpful for us for the sake of discussion. Nurses on the team, similarly, it's going to bring over each nurse, Carlos, Brittany, bring over the information we have. And one of the things is that it's going to ask us this question: is the nurse an RN or APN? We are putting yes or no. If we say no, a follow-up question will be asked: is the nurse an LPN or CMA? And so you can see how the rating keeps changing based on how we're judging these. So you have to make sure you're filling out these questions, and then eTMACT is giving us the output. And then role of nurses is similar. We'll get some information here. This up here is not written out in a clear way. It's pulling information about how people are getting their oral medications. So 6% are getting it on their own, 13% residential. So overall 19% is not by way of the team, 9% natural. So it's teasing this information out to try to make sense of how we're going to be rating here. We'll work to improve this part of the dashboard because it needs more explanation. Now we're going to shift to specialist team. And for the sake of this rating tool exercise, we're just going to walk through the first three because the rest of them are all designed in a similar way. ST1 is going to pull over each individual that was designated as being a co-occurring disorder specialist. It pulls over the data in terms of how many hours a week. Also, how many notes did we see when we looked at the chart review? We manually input from the interview. So you'll go to the interview to see what they said to the question about how their time is being used. So we input what they said here, and then we think through the rating guidelines and we make a judgment of what we think the adjustment would be if we're going to adjust it. Then we indicate whether they meet minimal qualifications. There's a tip in here to remind us of what that is. There's lots of tips in here, so definitely look at the tips. This one's an important one. And then pretty much we can skim this information, but it's starting to already toggle for us what the output will be. Let's just say that 40%, and I had other reason to go lower to 40%, that didn't change anything. So if I were to go higher, say 70%, see how it changed it to 4? So everything is programmed to fill out the right anchor once we get the input up here. Now, co-occurring disorder specialists in treatment. We can visit the chart log tally to see some information about assessments. We can go to the interview responses to see what we captured there. We can look at our chart entry summaries to go to co-occurring disorder specialists and try to see when the co-occurring disorder specialist shows up, are they strong examples? How prevalent do we see them showing up? And what's the nature of the work? We use that information to then make these judgments here, and we'll get the output like we always do. Here is something to keep in mind. The specialist team items are the only ones where there is an opportunity to essentially do a skip where you're not rating the items. There are rules to when this is used. Those rules live right here. If no person is hired in the role or they're new, you can basically use the skip criteria. You would still have rated them on ST1. That is not one you can skip. But on ST2 and ST3, if they meet the criteria to qualify for a skip, what you would do is press this. Similarly, ST3 is asking about their role within the team. You're deciding yes or no. There's plenty of tips to give you more information. And then it's programmed and it's collecting, see down here below what your choices are. And if they qualified for the skip in ST2, they should qualify for it here. And you would press this red, does not rate apply.